of the patient in bed in different positions and also some transfers, okay, and where we should be as staff and how we should position them. So first we'll start with in bed. Penny's gonna be my helper. I already begged her to do that today. So when we're lying supine in the bed, obviously, and you always have to pay attention to the orders, if they're supposed to be supine and repositioned to the side or whatever, you guys always know to do that. Is this a good positioning spot that way? With her?
Underneath the
No,
knees.
right. We need to get these up underneath the knees, okay, a little bit more. And then feet spread apart a little bit, not crossed, okay? We don't wanna be doing that, okay? Just like that. I really like the pillows under the bed. It drives me nuts when I see somebody in there with their feet flat, because that, even those couple inches really can pull on a person's knees and their joints. It could really hurt them. So make sure you do put the pillow under unless the patient specifically says, I don't want it. Also, we don't wear shoes most of the time in bed, right, because of heel and different issues. So we would put their heel bows on if they have to. And what else do we make sure is on? If they don't have shoes on, what else do we make sure?
Gripper socks.
Gripper socks, yeah, we always wanna make sure the gripper socks are on. Head of the bed, 30 degrees at least after you eat, after they eat, usually more, I think, and after somebody's eaten, but make sure it's up a little bit unless, again, they like it flat. I would think you would want it up a little bit for support. So this is good. Is Penny in a good spot in the bed?
Yep.
Yeah,
in the middle.
she's in the middle, okay? That's another thing we do have to be careful, like when we roll them, when we reposition somebody, that we have them in the middle of the bed. And we also have everything they need and they have ordered on the sides of the bed. Like if they have the new noodle / body pillow things, we gotta make sure they're in order. And when we roll, we'll show you. You gotta make sure that you get their tushies and everything back in the middle of the bed, so that if they do happen to move, if it's one of our patients that kind of throw themselves all over and move a lot, that we have them in the best position available, that we know that we made them safe when we walk out that door. So we're gonna talk about rolling and positioning on our side, okay? So first of all, we're gonna definitely remove this pillow underneath there, okay? Also too, with the bars, if you guys think that somebody would benefit from the bars, you guys probably do a lot more rolling on your second and third shifts than we do on day shift, or I do as a therapist. So if you think that somebody would benefit from a bar, please let us know, let your nurse know. They can leave a note for us or something, and we can help you out that way. Because a lot of times it's nice to have the bars. They help you really roll over. Okay, so Penny's gonna roll. Sometimes when you do, one thing with rolling, I know this isn't always in it, but one thing with rolling, if a patient is capable, have them bend up this leg a little bit and then push a little, okay? And see if they can do that. Now, come back on your back like that, okay? Push this leg up. Now grab the bar, Penny, we're gonna have you roll over. Now, this is not good, right? Because of where we are. If the patient can't move themselves back, Penny, can you move back a little bit? Have them. If they can't, this is where we get our grab bars, or what do we call these?
The draw sheet.
Draw sheets and your pull-up sheets, and get them in the middle of the bed, okay? So she's on her side, okay? What do we wanna do with these legs?
Elbow.
Is this acceptable right here?
No.
No, that's not comfortable even. Have anybody ever tried to even do that? That's so
it's
super
not
uncomfortable. No, okay? So what you wanna do, make sure this leg is getting, you can put the pillow here. Make sure this leg is getting up and over that leg in front of it, not behind it, okay? Make sure the hips are pulled over, and she's really, especially if it's a person you're looking at to get, them off their bottom for skin issues, really get them over, get that foot over. One other thing we don't think about all the time, because it's hard, she's very good, but she also has her shoulder out a little bit. You're kind of almost a little bit more on the scapula, not straight on the shoulder, because that could get sore after a while, and sometimes our patients can't even tell us that. So she's in a good spot, right? Okay, if you really need somebody who, if somebody's really flowing around and then throws himself back, this is where you could put, and I didn't bring one in, one of the wedge cushions. Now, do you put the wedge cushion way down here, under here? No, it's more up here. okay? Especially a lot of times for the skin issues, you're trying to take care of their back, okay? All right, now Penny's gonna come back on her back, and we're gonna transition into the transfers out of the bed, okay? And some different transfers. Okay, this is one pet peeve of mine that I see, and people just may not know it. Penny, give me your hand, let's sit up. Oh, that drives me bonkers, okay? That's not good for their arm. A lot of them don't have the strength, and I don't see any, you guys do, but I do see some people once in a while, maybe the ones who just don't know as well yet, okay? If we're gonna sit up, the best thing, we're gonna move the legs first. We're gonna say, Penny, we're gonna pull these off the side, okay? Get her, and as much as they can help, let them help, because the more we push on them and pull on them, the greater risk for injury, so we wanna not do that. Now, what I usually do, I kind of grab a hand here, and I will scooch under here and get right along the upper back, the scapulas, and then bend, and then pull them up into a sitting position. So even if I'm doing this on this side, I still, if it's a 2 assist, I still would not want her grabbing her arm and pulling her out, or even grabbing here and being this last couple inches like that. We gotta make sure we don't do that, okay? So that's a big thing. All right, so she's sitting on the edge of the bed. She's fine, she's got good balance here. We're gonna practice a few transfers, a few different ways of doing things. First of all, it's important to follow the orders, okay? Because in therapy, we do go over everything with the patients. If somebody tells us they're not doing well with the walker in the bathroom, we will assess that. So please try to follow the orders. Sometimes I know, like, we'll go in the bathroom and we will have them have a walker, but you guys grab the bars. And really, you could get in trouble for that if, like, a state would come in and watch you transfer them and see that it's a with a walker order, and then if you just use the bars, we could get nailed on that. We could, and we have in the past. So we do have to follow the orders. You do have to follow the orders, and but if you do feel something like we're like I said, in therapy, we'll change whatever is better for you. We have to assess it, but it has to be changed, and we have to follow the orders specifically. So if it says rolling walker, 1 assist, 2 assist, you have to do it that way, okay? So we're gonna start with the walker, and how we wanna position, let me pull this over here. Okay, so, you guys use the brakes on your wheelchairs?
Yeah.
Yes, very good. Good answer. We always want the brakes on, okay? I know sometimes it's hard, we have a tough one, we might need to pull it up, but if we, in that case, get the third person, okay? Now, when you're standing and transferring somebody, this is, I'm gonna pull this here to get a little angle. What I do, say it's a 1 assist, okay? So you always wanna go, if Penny had a stroke, okay? And she was just weak, not like, not fully hemiplegic on this side. She has strength and can do stuff. We wanna always try to transfer to the strongest side, okay? So her right side is stronger, so we always do wanna try to go that way. It's not gonna happen 100% of the time, especially in the bathroom, different things, you're not gonna be able to, but for the most part, try to get it to the strongest side. That's like if she's coming from there back into her bed and the right is her strongest, you may have to back the chair in and go that way. It just might be easier, okay? So the other thing, when Penny is transferring, a lot of times we in therapy like them to push up from the bed, but that just doesn't always work. That's the safest thing, because if they put their hands up here, they could be pulling on that a little bit, but sometimes it's just the easiest thing to do for them, because they either get confused or they can't transfer from their hands from there to there. So we have to play that by ear and see what happens, okay? Now, the other thing, when you're transferring somebody, this is one thing I do see a lot. Okay, we know Penny's a 1 assist, so she's not too hard or anything, so we know she's pretty good. We just kind of go like this, hey Penny, let's go. And there's that arm. See how much pressure is right there, and this hand's just doing nothing? Okay, sit back down. 1 assist, we have to have a hand on them for the most part, okay? 2 assist, this goes for 2 assists as well. You want to put a hand here, but this is not your main driver, you know what I mean? This is not your main support. Your main support should be back here. I really like to hold on to pants. I know it's not always the best. There's gait belts as well. But as long as this hand is back here and doing the majority of the pulling, that's the safest for the patient. Okay, so Penny, we're gonna stand up and I'm pulling here. Did I even really do much here, right? It's like, just like, you're just kind of guiding right here, okay? We're gonna, first of all, I should have said this before we stood up, but we're gonna stand and turn and sit there. So then my majority, I kind of go to the walker. I hold her right here. Now, you're gonna reach back and sit down. And then guide them down until they sit. But all of my support that I'm giving them is coming through here, not through their arms. Okay, same thing when we go back, okay? Now Penny's gonna go back, say there's a chair there and we can't get in. Penny's going back to this is her weaker side. I'm on the weaker side, that's the other thing. The therapist or the patient, if it's a one assist, the aide should be on the weaker side too, okay, to support. All right, let's stand up, let's push up from here this time, okay? Ready, 1, 2, 3, I'm pulling, where do you feel the support? Back here, okay, I'm just guiding here. We're gonna turn and sit in your bed, okay? Very good. Now reach back and sit down. I obviously realize that not all those transfers are gonna be easy like that. We know that, but. Okay, the other thing I wanna go over is the 2 assist. So somebody's over there, say I'm right here. Sometimes I see this. I've seen this a little bit lately. The other, I don't know, it's kind of weird. Sometimes the other person is way back here. And they'll say stand up and they still might have, okay, let's stand up, Penny. So I'm stuck way back here. And then what they try to do is, if they're to assist, they're trying to stay here. And here we're flobbing, this girl doesn't know where to go because we're trying to get her over into this chair. And I've kind of lost my spot here. This girl's lost her spot. So the best thing to do, let's come sit over here. I've seen that a lot. People get stuck behind the wheelchair. Do you guys understand what I'm talking about? A wheelchair, a chair, or something. I've seen it a lot lately. You need to give yourself enough space. And 2 people, Beth Ann, would you be my second? Thank you. Okay, so we're gonna stand up, come sit over here, Penny, okay? Right here, I'm still doing the same thing. See how I'm bending at my knees too? I'm not bending just like this at my back. We're gonna stand up, 1, 2, 3. Okay, now I'm gonna follow through here. Okay, Penny's gonna turn. And see how that's a much nicer, safer, easier transfer, okay? I've been noticing that a lot more lately. A lot of people get stuck. Even a couple of my girls have done it. I've had to educate them, the newer ones, you know? So we do have to make sure you're in a good position, give yourself enough room for the transfers, and then make it safer for the resident, okay? Thank you, Beth Ann. All right, let's go back over here, Penny. One assist, here we go. Wait, let's try to push up from here. That's it, good. And then the same thing with the, just have them walk so you have room to get around, okay? One last thing we'll go over, the same thing, sorry. Beth Ann, can you help me again one more time? The same thing with the pivot without, say we have somebody without the walker, okay, and we're coming here. Now in this case, you do have to bring the chairs close, but notice how I'm in front of her, not standing in this little spot here, okay? And we're gonna do the same thing. We're here, we're gonna pull it here, 1, 2, 3, pivot, and I'm right here, and there she is, okay? Same thing. All right, last thing, thank you.
Are you sure?
Yeah, I think so. We're gonna practice the cane, because we have had cane use a little bit the last few months with some people we've had. So if Penny has a left knee replacement, or a hip replacement, let's do hip replacement. She has a left hip replacement, what arm do we wanna put the cane in?
Opposite one.
Yeah, the right, you wanna put it in the strong side, okay? So, okay, yeah. Okay, we're going to stand up, cause you are gonna be on this side if there's still one assist, okay? So we're gonna stand up, you're gonna use that, and you're gonna walk over here to the bed. So you're still on their weaker side as the patient, and I got lost here, so she's good, she's okay to go and sit, okay? Any questions about anything? We haven't had a lot of canes usually they're pretty much ready to go out the door if we have you guys using a cane with them on the floor. So they're usually doing okay that way. Any questions on anything? Nope. Megan, did I cover everything? Okay, thank you, Penny, very